Got another one. Anna on the line.
Morning, Anna.
Morning, Anna.
Hello.
So
Hi.
you constantly feel the need to go to the bathroom?
Yes. As soon as I go to the toilet, I straight away need it again, and it's a severe desperation all the time. It's 24 hours a day. I've had it for nearly a year now. It started in December, and it's just, I've been to different people and they've just not been able to help me. They've suggested things. I've been on, I've had infection tests, I've had antibiotics, I had an operation done which wasn't successful.
Oh, gosh. And you're a dancer, and this is, when you say you need to go to, this is going for a wee, so this is no good for your job either, is it, at all?
Not at all. It's probably the worst job for it, really.
Oh, no.
Yeah, all right. Ranj?
I had a chat with Anna earlier, and it's having a massive impact on her life in terms of work and just general day-to-day. So what she's describing is something called urgency. Urgency is like a desperate need to go to the toilet. Even if your bladder doesn't feel full, you just feel like you need to go. And when you go, sometimes you don't pass very much at all, if anything. There's lots of reasons behind that. The classic one is urine infections, and you've been tested for that and treated. But there's other reasons. You can have something called bladder instability, where your bladder is essentially very nervous and contracts involuntarily, and you feel this sudden need to go to the toilet. There are underlying medical conditions that can cause you to produce more wee, so you need to go more often. For example, diabetes or neurological problems like multiple sclerosis that affect the nerves that supply the bladder. Anna's had lots of tests done already. She's seen a specialist and she's tried medications. She's doing the general day-to-day stuff that we recommend to everyone, and that's things like trying to retrain your bladder. So that is making sure that you go to toilet at set times, but also trying to hold it in as long as possible, so you're retraining your bladder muscle to do that.
So she needs to try and control it.
Training the muscles. It's called retraining the muscles, as well as, you know, building up your pelvic floor and things like that. So the next thing I would say, she's had a bladder stretching procedure already, and they've tried to also look at the muscle that's at the outlet of the bladder as well to see if they can stretch that to help things.
And nothing's worked?
That hasn't unfortunately worked. Now, we had a chat earlier about the next option could be something like Botox injections into the bladder. Now, Botox, we know, relaxes muscles of other parts of the body, for classically the face when it's used cosmetically. But if you inject it into the muscles of the bladder, it can relax the bladder a little bit as well. And that's something that I think you should really think about. But for something like that, if you're really struggling with ongoing symptoms, go and ask for a referral to a neurologist.
All right, good luck with that. At least that's another option.